Aspirin and bone health, is there a connection? This study's findings do not support claims about the benefits of low-dose aspirin in older adults. About the alleviation of early symptoms of fracture or prevention of age-related. The new study conducted in a JAMA is the first randomized, controlled trial to investigate whether aspirin use can increase the likelihood of fracture. An interventional study is more potent than an observational study and can help determine the relationship between aspirin use and fracture. The study involved 17,000 randomly selected elderly patients, most of whom were aged 70. The subjects were then monitored over the next 5 years to see if they experienced injuries or a severe fall was defined as one that required an emergency room visit or hospital stay. The average age of participants was 74. The researchers discovered that severe falls and fractures occurred more than 8-fold in individuals who took aspirin and roughly 9-fold in this group who took none. There was no difference in fracture risk for individuals who had taken those medications. People taking aspirin have a higher rate of injury severe enough to be categorized as falls. This may be due to aspirin's blood thinning effect. An injury that required only minimal bandage or controlled bleeding could have more profound consequences if aspirin were a contributor. These studies do not demonstrate that low-dose aspirin enhances bone density or reduces the risk of fall-related fractures, even though rating. Possibly even so, aspirin is proven to raise the risk of more severe falls, especially for older. The risk of stomach ulcers and gastrointestinal bleeding from aspirin and non-steroidal anti-inflammatory reactions to aspirin are severe. Coca-Cola would like you to take care of these reactions carefully, noting allergic reactions and worsening respiratory conditions. Aspirin hypertension research may lead to debilitating bleeding in individuals with hemophilia or recently taken other blood. Aspirin treatments to curb cardiovascular disease have been popularized in the past few decades. However, recent research and guidelines now recommend that aspirin not be taken for routine cardiovascular purposes unless those who have suffered a myocardial infarction or stroke have other dangers or conditions that call. Although aspirin waits on its reputation as a miracle drug, this new research is a reminder that aspirin is not suitable for everyone or every condition. Even wonder drugs have limitations. And this new research is the latest in a long line of how excellent results in placebo trials can be unreliable and that they will probably not hold up after treatment with. Whenever you read a news report about medical treatment, keep this information in mind. Whether the medicine is an unproven new one or an over-the-counter drug already in your medicine cabinet. Matthew, the video creator, is 83-year-old cancer/stroke survivor who would like you to know his passion for helping others by spreading good health information. Please help by taking a moment to subscribe and like this video.